I'm Dr. Alan Muskett from Billings Plastic Surgery, and I'm here with Tricia Kelly, who's a registered nurse who works here at Billings Plastic Surgery as well. And what we're here today is to talk to you about breast augmentation. Now, you see a lot of advertising for breast augmentation, a lot of fancy websites, but we would like to give you today kind of a real view of what breast augmentation is like, what it's for, what to expect, and really pretty much everything you need to know about it. So let's talk about the process. Let's say that you're interested in breast augmentation. The first step would be to make an appointment here to see one of the physicians. And now if you're a patient coming in, say what kind of questions would you have of the doctor?
A lot of the real common questions that people come in, one is what size am I going to be? Mm-hmm. They usually come in with a cup size in mind, not so much volume size, which is what we deal with. Mm-hmm. One recovery, as far as how long it's going to take to feel kind of back to normal or can do activities that you're used to doing. Mm-hmm. That's pretty much the basics. We start digging into a little bit more when we start talking to patients about occupation, what they do. Again, their goal and size and their reasonability to attain that if it's possible. Lots of those types of things. And then, of course, concerns with any kind of basic surgical procedure, infection and bleeding, and that's never zero.
Right. So I think one thing that we offer here at Billings Plastic Surgery is a very comprehensive consultation. So we'll talk to you about the options that you have as an individual. We do very precise measurements of the diameter of the chest, all the different measurements that occur in a breast examination, so that we can fit very precisely the implant to your body. We talked about things like what kind of work do you do, when can you return to work, what are expectations in terms of recovery, how long will it take you to see the final results. So one thing that's very important is when dealing with breast augmentation, you want to make sure you have a board certified plastic surgeon, not somebody that took a weekend course, and that you have somebody who has a lot of experience and someone who really understands the process well. And we feel very strongly that we do a good job of that here. And then we talk in great detail about the procedure so that you understand what you're getting into. Now, there are different kinds of approaches to doing breast augmentation, and there's a lot of things that you see in advertising that you need to know about. There's the most common incision is the one under the breast, where the implant is placed under the muscle, and that's through an incision about that long. It's about just under 3 inches in length. And that's probably the safest incision with the lowest incidence of long-term problems. People have talked about putting implants into the belly button. Those can only be saline implants, and for the most part, we're doing very few saline implants these days. There's an incision in the armpit where the implant can be placed in through the armpit. We've also seen some significant problems with that as well in terms of nerve injury to the nerve of the arm, and also the placement of the implant. So there's different considerations for each of these approaches, and we'll explain each of those to you so that you have a good understanding. Tricia, what happens after the procedure? What is the recovery like, and what would you advise somebody in terms of what to expect after the surgery?
Well, I always tell patients, particularly right after surgery, they're going to look like we just kind of went and stuck them on your chest. They're going to look tight. They're going to look high. They're going to just look like we suction cup them to your chest. It takes about 6 months for everything to happen, that being all the swelling to come out of the breast, the skin to relax, the muscle to relax, the implant to kind of find its own little spot to give you more of a natural breast shape, and to make it look like a natural breast versus a suction cupped breast to the chest. And that takes about 6 months for all that to happen and for the ripening process to take place. Recovery-wise, as far as pain, discomfort, kind of getting back to normal activity, everyone can be a little different on that, but on the average, I tell patients it's 5 to 7 days that you could get back to work. That's always the big one.
Yeah.
When can I go back to work? Obviously important, and it's about 5 to 7 days.
Now, what about when can they get back into a normal bra, for instance?
Well, we like to keep our patients in a compression bra total almost to 8 weeks, mainly because one, we want good support of the implant and support of the inframammary fold to let things scar down and let the swelling come out. And you're not going to be really able to size with a bra until that swelling does come out, and that takes 8 weeks.
Now, one question I'd ask too, you've seen thousands of patients with breast augmentation. What do you think the degree of satisfaction with the procedure is?
It's high. I find it's very high. Women, again, coming in either not having any at all and have had battled with just wanting to look normal in a swimsuit, not look like a boy. Feel feminine, wear a nicer, little nicer dress, sundress, or something like that to fill out. Goes a long way in women's confidence and making them feel more feminine all the way around.
And I found that very interesting because the satisfaction rate in our practice with breast augmentation is 98%. And that seems to me very high because, for one thing, 98% of lottery winners aren't that happy. It's just odd. But even people who might have had a problem with the procedure have a very high degree of satisfaction. So that gives me a lot of confidence in recommending it to patients because it's just a very high degree of satisfaction, and that's a pleasing thing to see as a surgeon, but also gives me confidence to recommend it to other people. All right, we'll look forward to seeing you at Billings Plastic Surgery.